We're at the point in the chapter where we're going to see some fancy physiology, and it's really going to be some stuff we're just going to generally look at. But I will say, like, a specific question that's good to know for test in this class would be, what is the respiratory control center? The medulla oblongata. We'll see that in the nervous system chapter later. But right now, let's memorize that the medulla oblongata is the site. It's near the brainstem. It's just a little bit higher up on the brainstem, and this really is going to be sending out impulses for the contraction of the diaphragm, etc. So this really is the, if you talk about life, vital life signs, heart rate, respiration, the medulla is really a major player there. And it's pretty complicated stuff, so let's just memorize the part. SIDS is a condition that they really don't understand still, and it's not common, but it is something that they do kind of warn every parent. It is possible for a baby to go to sleep and then not keep breathing during night. At a certain age, and I haven't read up on it lately, but after a certain age, a little bit older, babies are going to be safer. I remember they always talked about putting your baby always face up in the bed and not letting, don't put them face down. Have the baby sleep on their back, and they also say don't sleep with your baby in bed too, right? That's typically very common discussion of new parents. Don't sleep in the bed with your baby because of the risk of this, and they just don't understand it. Why would basically the medulla doesn't send an impulse to cause respiration, and that causes the baby to die in their sleep. So it talked about that. Here's a picture of our kind of general brain anatomy. Up here, medulla oblongata. You can see a bunch of nerves going down. There is one nerve that is good to know. It's right here, phrenic. Phrenic nerve is the motor nerve to the diaphragm. So there's a condition called multiple sclerosis, and it's a condition where the nerve's myelin sheath starts to disintegrate because of an autoimmune attack. It's rare. It happens typically if somebody's going to get it in their 30s or 40s. MS, we've all heard of MS. And so I always use that as an example, because the phrenic nerve, ultimately, someone at the end stage of MS, they can't breathe because this nerve has lost its ability to do a good signal. And it's a progressive motor neuron loss. So phrenic nerve, and it is bilateral. This picture, you can just see that, it's going down to the right side, and the right side is shown. You cannot see the phrenic nerve here on the left side because of the intercostal muscles. But, test question, motor nerve to the diaphragm is the phrenic. And honestly, think about frantic. If you can't breathe, you're going to be frantic, right? So that's kind of how I make sure I don't forget phrenic nerve. Because, guys, when we talk about a bunch of different nerves, it's easy. Once you get about 10 of them, when you do the nervous system chapter, you got 10 nerves, you start mixing them up. This chapter, that's the only nerve we've talked about. So the chemoreceptors, like when we talk about, how in the world, I'll just say in general, here's what happens. If you go outside and start running, and you increase your respiration rate, you didn't have to think about that. It occurred because you started burning more fuel in your mitochondria of your cells, and the waste product of carbon dioxide then went up in the blood. So ultimately, when you increase metabolism because you wanted to do something, like think about it, you voluntarily went and ran down the road. That's a voluntary action. The result was burning of fuel and production of carbon dioxide, which changes blood pH. And blood pH, carbon dioxide actually acts as an acid. So your blood pH goes lower, and you're going to have to breathe faster to exhale out the waste product. And when you exhale out more, you'll inhale more oxygen. So it's a chemical type of receptor actually they're located in the carotid arteries. They call them carotid bodies, and they sense the blood pH based on carbon dioxide levels. It's pretty interesting when you get nitty gritty into it, but this class we're just kind of generally discussing it. When you talk about exchange of gas in the body, it says here, the exchange of gases is dependent on diffusion. We're talking about simple diffusion, which means high to low concentration. When you breathe in, that breath of air in is going to have lots of oxygen compared to carbon dioxide. And when it gets down into the deep airways, like the alveoli, the air sacs, it's going to want, the oxygen is going to want to go into the body, into the capillary bed. And the carbon dioxide is higher concentrated in the capillary bed, so it wants to go out. So simple diffusion. There's no energy expense as far as cell transport. It's just simple diffusion. And you could look at the partial pressures. We don't need to spend, guys, this is beyond this class, but different people that look at this would basically look at the pressures of carbon dioxide and pressures of oxygen. You can do fancy testing with, getting arterial blood gases, and venous blood gases. Different people at the hospital will do different things and figure out how much oxygen is your body getting. Because, guys, think about this. If you had a lung problem where you had the inability to allow for diffusion, you could be breathing fast and deep and have good, general lung function, but ultimately, if there's no exchange of the gases, you could still be very, very hypoxic, which just means that you're not getting oxygen. So guys, honestly, let's kind of, go through this kind of quick and general. External respiration, exchange of gases between the lung and air sacs. And, like this is between the alveoli of the lung and the capillaries, I should say. So it's more external. And if we compare that, well, before we compare, let's look at this. This is what I'm talking about. If you're reading your book in really good detail, I am not going to test anybody on any of these specifics. This is more of a physiology, later on. I would say a general thing that is on some tests is the idea of hemoglobin. Hemoglobin, we really should remember, is in blood, and it's what carries the oxygen. And so they abbreviate hemoglobin with HB. And that's why we have O2 here. Oxygen is two atoms combined together. This is oxygen gas. And hemoglobin carries it. So that's just showing you the oxygen transport. When we talk about carbon dioxide transport, I kind of went to the oxygen first. CO2 is way over here. What actually happens in the blood is it's not really carried in CO2 form. It can be carried in other forms. And if you look at like HCO3, you can see how that's got some carbon and some oxygen in it. Here we have H2CO3. We're not in a chemistry class. We're not going to name these things. Just be aware, carbon dioxide really is carried multiple ways, and oxygen is carried by hemoglobin. Let's keep it that simple. This is a fancy picture, kind of showing us our heart, like we've seen in our heart chapter. We've seen this kind of picture. If you really want to get into here, if you're going to go into medical classes more so, and you want to really read up in the textbook, there's a lot of detail. But again, this is just a picture of kind of that fancy detail talking about the transport of blood gases, which we're going to skip that for this class. Um, let's get on to some basic diseases, okay? So I skipped through some of that physiology. Definitely for Biology 115, these diseases are helpful. To know the anatomy even. Sinusitis, and a lot of these diseases are so common we already know what they are. That's another good thing. Blockage of the sinuses. The sinuses would be cavities in bone of the head. The frontal sinus, earlier we saw that in a diagram, the sphenoidal sinus. Everybody's got a little different shape of their sinuses. You know, we're not all the same. And depending on those shapes, some people can get lots of problems. And anytime you see the word itis, it means inflammation. And typically we think of infection. You know, you can think of inflammation with infection whenever you see itis. If you see osis, which a lot of people have heard of, you know, something with the term osis, like, can you think of one? Scoliosis, that's a good one. Yeah, that's perfect. You know, nobody ever says scolioitis, right? That'd be weird. Osis means condition, so scoliosis is a condition of the curved back. You know, anyway, so those are just like, if you take medical terminology, you'll see itis and osis. Itis is what we're dealing with infection-wise. So look at this, otitis. Here we got it again. This is of the otic region, like, which means the ear. Otic, O-T-I-C means ear. So they basically drop the C and put T-I-S. And if it's in the media, that's the middle ear infection, which would be basically where the ear bones are, you know, behind the eardrum. You know, we're not going to look at the ear in this chapter, but it would not be in the ear canal. That would be an external ear infection. Otitis media is where the ear bones are behind the eardrum. And before you get into the fancy ear semicircular canals and trochlea, stuff like that. So the tonsillitis, same thing here. We kind of get the idea. Tonsils, they're infected. Laryngitis, I mentioned that earlier. These are all upper respiratory tract. These are lower. There's actually a slide coming up that shows us kind of some pictures. We should just memorize that pneumonia is going to have fluid, okay? Because there are diseases that have mucus, but pneumonia is if you say that you have fluid in your lungs, we shouldn't have any fluid in our lungs, in the air sacs. This is pneumonia, and definitely, guys, pneumonia can kind of sneak up on people. I think I might have told you that a friend of mine who's a medical doctor, he posted pneumonia was old man's best friend. Did I tell you guys that story? The reason why they consider it old man's best friend is pneumonia is a very easy way to die. You know, it's kind of painless. You can die in your sleep at night if you don't treat it, and a lot of people per year die of pneumonia. There could be some kind of thicker mucus in there, but it's really more of a fluid, and it's definitely a lung infection that you need to deal with. Tuberculosis is the one that a lot of people get checked for TB time, you know, to basically say, have you been exposed to tuberculosis, which is a bacterial infection? And ultimately, if you don't treat TB, you get calcifications, tubercles of your lungs that are just spread throughout. And that is like the encapsulation of bacteria. That's not going to be good. You want to treat TB early if you get it, not let it get, you know, widespread. Earlier I mentioned pulmonary fibrosis. So basically you can't breathe in or out as good. Excuse me, I'm going to cough. I'm demonstrating some pulmonary fibrosis almost. I'm still getting over my bronchitis, which is on here somewhere. Emphysema, guys, okay, we've probably heard of emphysema, but we might not know what it is. It really means overinflation. So we want to memorize emphysema is actually when it says they're getting damaged. See this? Alveoli are damaged. It did not say how they're damaged. They're basically overstretched. It would be like blowing a balloon up too big and the balloon stayed big. And if what we really need to allow for gas exchange is a certain size of these air sacs. If they're too small, air can't get in, it doesn't work. If they're too big, we can't get old air out, and that doesn't work. So emphysema, people with emphysema basically can't get their old air out to get fresh air in, so they start getting hypoxic. So any of these things can cause hypoxia, but this is definitely one of them. This would be one of them that's classified in the COPD category. Like if people say COPD, it means chronic obstructive pulmonary disease. Well, there's different treatments, and what are the treatments specific? Ultimately, you're looking at structural problems that you cannot fix, but you could manage the problem, why do people get this? It's just, remember, these lung pieces are like paper thick, and one layer thick and of cells, and genetics plays into it. They've done research on people who blow horned instruments, and there are diseases of people who are musical, people who play. And guys, it's amazing, the research. I can't tell you all about it, but my parents are into music, and they know a lot of music people, and different flutes and different reed instruments, and instruments can cause, and even blood pressure problems, and heart problems because of the pressure that you have to exert when you blow an instrument, And I'm not saying everybody who plays the trombone is going to die of whatever, but there are linked diseases with certain things, and that's definitely in the literature. And definitely with general everybody kind of stuff, smoking, that's the go-to. And, some people smoke. These vaping cigarettes things that people are doing now probably are better as far as toxicity of different burning chemicals, yes. But the nicotine, people are forgetting that the nicotine causes problems. Anyway, that's a big discussion there. So asthma, what do we want to know? It means that the bronchial tree, it says irritated, okay? But it doesn't say how. I would say that this is a hypercontraction of the smooth muscle in the bronchial tree. In other words, in the bronchial tree, we have a smooth muscle middle layer of the little tubes. And that is, I didn't mention this earlier, guys, but it's kind of in a different chapter. It's in the neurological chapter. When we are resting, our whole bronchial tree actually closes a little bit. And when we start exercising and we start running and we become sympathetic, they call it sympathetic, it actually opens up. So the smooth muscle relaxes, and they call this bronchial dilation. This is normal, and it's a way that we have a ability in our bodies to prevent infection when we're resting. Like if you think about, guys, seriously, a car engine, if you have like an increased intake of the manifold, the carburetor, or, the air intake, you get more air in and you can have more horsepower. Well, our bodies need more horsepower when we were running. So we have a variable opening for the air. We have vasodilation when we start running and doing activity. But it would be silly to have a humongous opening for bacteria to get into our lungs all the time, like when we're sleeping. So that's why we have smooth muscle in those bronchioles, that when we're resting, it actually constricts and minimizes the opening diameter of our airways. So it helps limit infection. And so that's an awesome feature for us. But some people have sensitivity and basically will have extra contraction of that smooth muscle to a point that they can't breathe very good. And then normally when we get stressed out, these diameters should open up. Stress, the hormone adrenaline is a smooth muscle relaxer, and that is like, that's why, like, honestly, the EpiPen, that EpiPen has adrenaline in it, and if somebody's going into a acute asthmatic attack, that's why you want to give them the EpiPen. It will relax the smooth muscle of the bronchioles and open up the airway, and they can breathe. Inhalers, the inhalers that asthmatics use, that's more commonly used. Acute asthmatic attack, EpiPen would help. But the inhaler is going to be very quick. You breathe it in, and it opens the lungs up. If you had an asthmatic that you didn't have any inhaler and they're having a problem, you could try to scare them really good. And if you could scare them really good, that would cause adrenaline to come out and might help them. So anyway, lung cancer, big topic. And there are, this is a big topic. Definitely lung cancer, if it's a primary site of origin from the lung, it typically would come from the epithelial cells. Think about that, guys. There's a lot of them. Definitely lung cancer can be a secondary site of metastatic cancer that came from somewhere else, like skin cancer can go to the lung. There are conditions like there's situations where genetically people can be more predisposed to lung cancer. Big topic. Let's look at some pictures here. I really like these pictures. Here's pneumonia with some fluid. You can see all that fluid. Test question. Pneumonia has fluid. Now, comparing that to bronchitis, bronchitis has mucus. And the mucus is more specifically in the bronchioles. Over here on pneumonia, we see the fluid in the air sacs. When we look at asbestos, guys, here's pulmonary fibrosis, and it's showing us asbestos. Let's talk about that for a second. Asbestos, we all know that we don't want to breathe any asbestos. It's illegal to have it in buildings now. It used to be in certain building products, especially pipe ductwork and heat, like insulation areas. Guys, in older houses, if you live in a house around here that was built in the 50s or 60s, probably it's got some asbestos in it. I've seen it in many, many different houses that I've kind of happened to work with. I've seen sheets of asbestos used to insulate even just the crawl space of houses. I was kind of surprised with that the other day. It's like a sheet of asbestos about a 1/4 inch thick. It's pretty hard, like a board. You don't want to breathe that stuff. And the reason, I'll tell you guys, the reason why asbestos is so dangerous is the shape of the asbestos is like a needle. And it's not that it's sharp, like cutting your lung up. It's that the needle acts like an antenna. It acts like an antenna, and what they've found is electrons will flow off the antenna. And as electrons flow off the antenna, you get what you call, they say, Leo the lion goes grr. Leo means lose an electron, is oxidation. So you get you get increased tissue oxidation from asbestos being in your lungs, which ages those cells, which causes them to get older, which causes them to more likely to get cancer. Like if you compare asbestos to sawdust, sawdust does not have the needle effect of the electron flow. And talking about, guys, like I'm giving you a lot of detail here, but it's so interesting. If you think about antioxidants, we've all heard about taking antioxidant vitamins. Their goal is to lower the loss of electrons from our cells. And it just doesn't make sense because we're not really chemistry people. Like if you think about losing electrons, that actually is the same thing for metal, like rusting. Metal rusting is the loss of electrons. So think about the change, metal turning into rust. Well, now think about your body cells. They're not going to turn into rust, but that loss of electrons ages them. And so that's why they say you should take some antioxidants, or eat healthy, good green leafy vegetables, all that good stuff. And nutrition, it lowers that effect. Um, Here's our emphysema. Look at that. Look at how big they made this. See that? So you breathe air in, you can't breathe it out. I mean, you can still, have some air motion. Also, I would say, guys, think about our lung. Have you ever tried to breathe through one straw? Like you go to McDonald's and you get a straw and you're just sitting there and you're resting and you put the straw in your mouth and you kind of don't breathe through your nose. Have you ever tried that for a minute? You might have tried it for a couple seconds and air goes in and out. But I will bet you right now that nobody in here can live with one straw. And the reason, think about this. Now, if you had two straws, you probably could, but you wouldn't be able to do much. You wouldn't be able to walk around and live with two straws, like when you increase your metabolism. Three straws, everybody's different. It depends on your body size. Try it sometime. What I'm illustrating is the distance of the straw and also the volume the straw can move. Just an interesting little fact. They'll do tracheotomies, right? They'll basically pop a hole through the trachea that's just below the Adam's apple. If you do that, so it'd be like right here in this picture, if you trach somebody, it is 30% easier to breathe, which is kind of crazy when you think about it. It cost us, our body, just from the, like, below the Adam's apple, out the mouth and nose, 30% more effort to breathe. And there's two reasons for this. The biggest reason is there's some stale air that is always in this. When you breathe out and you breathe it back in, there's going to be a little bit of mixed air. So it's not completely fresh. And if you put your point of entry closer to the place of exchange, you will increase that exchange rate. That's one of the reasons. The other is just the fact that it's got to go further through the mouth. And so they'll trach people at the ICU sometimes if they're really struggling. It might not even be a lung problem. They'll just trach them so that way their bodies can breathe easier and they can recover better. Just interesting stuff.
Are these, like emphysema and pneumonia, do they always, is there like certain spots of the lung that they might have more than others?
Yeah, that's a good question. Definitely the different areas are impacted. Bronchitis, like I can tell you guys, I'm on antibiotics right now in prednisone. I've been trying to cough up some mucus plugs that are somewhere deep down in here. I mean, I can kind of feel them rattle. I don't feel a lot of stuff up here. The doctor, when they listened to my lungs, didn't hear anything, but I know they're there. When I cough, I can feel them rattle. When they auscultate a chest for lung sounds, that means listen to the chest, they're going to listen for wheezing, and wheezing is typically associated with like bronchitis or asthma because of narrow airways. And stuff like asthma would be more global for sure. This is because it's neurologic more so. Typically, it'll be like all the bronchioles. When you think about, emphysema, that's a tough one. I would say it's probably kind of sporadic. Damage to the air sacs that just happens, kind of like, I don't want to say aneurysm here, but like, why does an aneurysm occur? Too much stress and aging of the vessels. So, we've got so many different branches here. Which branches are weaker? There's a lot of things you could think about here. Well, I was going to tell you guys something else interesting, but I'll think of it in a minute. But, which ones are more associated with infection? Definitely pneumonia, bronchitis. Which ones are chronic, just exposure to pollutants, pulmonary fibrosis. TB is more bacterial. These are just all possibilities. So if it's chronic, meaning lasting a long time, and you can't breathe good, basically it's in the COPD category. Pneumonia would not be a type of COPD because it's more of an acute infection that's temporary. Um, anyway, so they talk about how we shouldn't smoke. Guys, oh, here's something interesting. We've all heard that smoking could cause lung cancer. The number 2 location of smoking, and this is more FYI, but anyway, where do you think the second most common cancer smokers get is? The throat would be a good guess. It's not the throat. Mouth, no. Bladder. Bladder cancer is the number 2 cancer of smokers. The reason why I tell you this is back to that idea of, wait a second here, how in the world, right? How in the world can our bladder be the number 2 location? Because the smoke only goes in our lungs. Well, those toxins that go into our body have to be filtered. Our kidneys filter them, and then those toxins are stored in our bladder until we go pee. So if you're always smoking, like smokers smoke every day usually, you always have toxic urine, and that irritates the bladder and causes bladder cancer rates to increase. And the third is kidney. So it goes lung, bladder, kidney. Those are the most likely cancers of smokers. It's pretty interesting, really. Anyway, so that's stuff that the book doesn't talk about. That's just kind of cool to mention. And like, look, I mean, they're even saying increased risk of cervical cancer with smoking. Isn't that incredible? You know, so it's beyond just the lung, like most of us would think, and that's that's what we all, even myself. You know, I always worried my Aunt Cindy, who smoked, would get lung cancer. She honestly has smoked her whole life. Her lungs are burnt up. She has smoker's hack cough that annoys her all the time, but she's 74 and still alive. But definitely it's affected her ability to do things. She doesn't ever go hike a mountain or anything or ride a bike. She is very, very sessile. Okay, so that's the end of this chapter.